Treatment options for infertile couples include both IUI and IVF, and both of these are lumped together as ART or assisted reproductive technology according to the ART Act. But the reality is that very different treatments which are appropriate for very different set of patients. Yes, there are some patients for whom both IUI and IVF are equally suitable. For example, patients with polycystic ovarian disease who don't ovulate, and patients with unexplained infertility, provided the sperm counts are good and the tubes are open. But IUI has major limitations. The huge advantage of IUI is that it can be easily done by a gynecologist and is much less expensive. But the trade off, of course, is the success rate is much lower and it's applicable only to a certain group of patients, which is why you don't just do IUI because that's what your gynecologist tells you to do. You need to make a well informed decision for yourself. So, for example, for people with male factor infertility, IUI is a terrible treatment option with very poor success rates. But gynecologists sometimes mislead patients and say, oh, we'll wash the sperm and we'll get the best quality sperm. But if the sperms aren't capable of fertilizing the egg, then washing them is not going to help. And this is why not only do you need to understand the difference between IUI and IVF, you also need to have a cap. You need to decide, fine, I will try a certain number of IUI cycles. And if you're not pregnant in 3 IUI cycles, then doing a fourth and a fifth is a waste of time and money. And changing the gynecologist will not help. Far better to move on to IVF because it's the best chance of getting pregnant before you get fed up and frustrated.